the fact, but we are at about 6:02. Nina, welcome. And I think I will start with the intros because we seem to be at a steady point. So my name is Lisa Del Bono. I'm the president of Michigan Clinicians for Climate Action. And I just want to thank every single one of you for being here and taking time today to talk about why we as health professionals should educate our peers and our patients about the importance of exercising our right. And I would say our responsibility to vote. As the American Medical Association, the American College of Physicians, the American Public Health Association, and the Society for Public Health have all stated voting is a social determinant of health. Public health outcomes correlate with access and participation in the voting process. And there is no way to overstate the fact that health and climate change are on the ballot this year. We know that policies directly impact human health in a variety of ways. Whether we're discussing fossil fuel pollution and its impact on air quality and climate change, or we're discussing access to affordable and dependable electricity, water, and healthcare, our elected officials have the power to make and enforce laws and regulations that impact the health and well-being of every Michigan resident. A functioning democracy depends on active involvement of an educated citizenry, which includes you and me as health professionals. Surprisingly, though, studies have indicated that health professionals actually vote at a lower rate than the general public, probably because of our schedules. But we must make it a priority to go to the polls regardless of the demands our schedule places on us. And in Michigan, we're really lucky. We can vote early. We can request an absentee ballot for absolutely no reason. And we can actually apply for a permanent absentee ballot so that we get a ballot in the mail every election cycle after the single application without requesting it. And if we care about our patients, we should educate them and encourage them to educate themselves and encourage them to go to the polls. And so fortunately, we have Ari Khan here, who's the Michigan organizer for an organization called Vot-ER. I would guess a lot of you are familiar with Vot-ER. I know Mary Lee did a fellowship with them. They are a 501c3 nonpartisan organization that works at that intersection of public health and democracy. They have been incredibly innovative, and I can't wait to hear about how their process and how we can all engage with it. Ari personally is very passionate about civic health, and she seeks to bridge voter accessibility gaps for underserved communities in particular throughout the state of Michigan. So I'm going to pass it off to Ari, and a big thank you for making the effort to do this presentation today. Welcome, Ari.
Thank you so much for that warm introduction. I really appreciate it. I'm just going to share my screen with these slides. Let me know if you can see this all right. And just before I get started with this presentation, I just wanted to touch on how important this work is. We operate in a nonpartisan way to advocate for the importance of participating at the polls as it relates to our health. As Lisa mentioned, we cannot afford to ignore these issues. And in this discussion today, I hope to touch on how voting is a social determinant of health. But before we dive into all of this, I'd love to pass it to Nyana just to talk about the CME-CE credit for anyone who's looking to get that for themselves or who needs it. So Nyana, over to you.
Thank you, Ari. So yes, this slide here, y'all, you will see at the beginning of the presentation and also at the end. So feel free to take a picture. This is how you'll be able to claim your CME-CE credits after the presentation. We want to let you know that probably going forward, we will be trying to see if anyone is interested in donating for our CME, as it's not free for us, but we always want to make sure we can make it free for you and continue to be able to provide these services. So any donations going forward will be super appreciative. You will have an option to when registering for upcoming events. And then below, you will start to see on your screen somewhere a poll question that's going to come up. And this poll is really just wanting us to try to figure out, how do you feel about CME being offered at these meetings? Are you finding it helpful? Has it been hard for you to access? Just want to make sure that, you know, since we're providing this service, that it is helpful for all those that are coming to our meetings. And then there will be a second question that will pop up. And the second question really is all around how you all are feeling around voting being a social determinant of health. This question will be asked at the beginning here, and then also at the end after the presentation, to see if your outlook or mind has kind of changed or evolved throughout the presentation. But thank you, and I will pass it back to you, Ari.
Just a second. Did we want to share the polls at all?
I just ended the first poll and the second one just started. I'm going to leave it open while Ari's talking, and I'll share the results at the end.
Okay.
Thanks so much, Lauren. And thanks so much, Nyana, for that introduction of things. Let's dive into it. If y'all are able to, I'd love for you guys to introduce yourselves in the chat with your name, your pronouns, and if applicable, the organization that you represent or the position that you hold. We're going to dive into the link between voting and health, both with the indirect and direct benefits, how Vot-ER specifically comes in, and answer any legal FAQs you have before we move on to next steps, which is taking action. So to dive in, let's talk about the link between voting and health. Now, we can see this link nationally with the Healthy Democracy Index. As you can see here, on the upper end of the spectrum is better health going up and more voting access going towards the right. So you can see that states with less voting access tend to have worse health outcomes, while states with more voting access tend to have better health outcomes. And if you can see over here, Michigan tends to be a little bit in the middle of the spectrum when it comes to having more voting access, but we definitely could have more accessibility than we currently do. And perhaps that might improve our health outcomes, seeing as we have a lot of work to do there. So we cannot begin to address the social determinants of health until we begin to address and point out our interventions towards the structural determinants of health. This is where voting plays in the upstream causes of the causes, where voting is the most effective. Problem is, too many people don't have a seat at the table to vote. Did you know that in the United States, there are 72 million people who are eligible to vote, but aren't registered? To put that into perspective, that is essentially the entire population of France. So imagine if no one in France ever participated politically. It would mean not the best for citizens being heard and represented. This is often because folks have never been asked to vote. When this poll was taken, we learned that 62% of unregistered eligible voters were just simply never posed the question. Now, I don't want to take away any of the real structural issues that come into play as to why folks don't register to vote or why they maybe haven't been able to before. There's a lot of real things to point to historically and politically. However, if the question hasn't even been posed, how can one even begin to think about the impacts that voting might have? That's why it's so important to see these same Americans as our patients. When you look at the top 3 groups of people who disproportionately make up those 72 million unregistered voters, they're often young people, low-income people, and people from communities of color. And when you see your patients who come in for treatment for low acuity complaints and the patients who are the most marginalized by our healthcare system, who do they tend to be if not these same 3 groups? Now, what would change if these patients were asked to register to vote? How would this begin to transform their healthcare experience? And I'm not just asking these questions to ask. Feel free to drop in your thoughts in the chat. Now, a 2021 study from the Journal of General Internal Medicine found that health professionals are 12 to 23% less likely to vote than the general population. So what does it mean when our patients don't vote, but our pharmacists, our registered nurses, physician's assistants, dentists, physicians themselves, when they don't vote as well? What does that mean about healthcare policy and how it's being received on the floor? I can tell you one thing. The American Medical Association recognizes the link between voting and health. In June of 2022, in fact, the AMA passed a resolution that recognized voting as a social determinant of health. And this also extends to the Association of American Medical Colleges. 2022 was a huge year for public health and democracy and just proving that connection. It's really important that we prove it amongst these circles too. Now, there's a lot of indirect benefits of voting on health. Civic engagement, racial and social inequities, and need for healthcare providers to vote are the things that we'll be getting into in this discussion today. But the first thing we'll talk about is how civic engagement directly promotes health. Now, voting, the social determinants of health, and community outcomes all have a complex relationships, but I'm hoping that these following maps will help illustrate the issue in a way around voting and health. Detroit is a city that we're going to look into for this specific example. And feel free to drop in the chat when the last time you went to Detroit was. It's my favorite city by far. Specifically, we're going to be looking at Chaldean Town in Detroit. It is a deteriorating neighborhood. Many of the streets behind the main business strip are full of abandoned homes, and the schools are slowly getting more dangerous, and crime is pervasive. The school to prison pipeline here is unfortunately really strong. And at the same time, their voter turnout rate is not as high as it could be. In 2013, in fact, it was 14% lower than the citywide turnout rate in the 2013 mayoral election. Now take a look at this map. In terms of life expectancy, this town had a life expectancy that was 6 years lower than the state average in 2015. It's really hard to sit with this, but let's expand to Southwest Detroit. Look at this map right here. Amidst all the wastewater treatment plants, the steel plants, the oil storage, the oil refineries, the power stations, people live here. You have citizens, you have families, you have children, schools are here. And at the same time, there are over 24 industrial sites. As a result, residents here have a life expectancy that's 7 years lower than the rest of the United States. Asthma hospitalizations are 2 times the rate of the state of Michigan as a whole, and 5 times the average rate of the United States. Now here you can see the relationship between health and voter turnout. There are 4,800 election precincts in the state of Michigan. And out of the 100 lowest turnout precincts, 41 of them are in Detroit, and 19 of them are in Southwest Detroit. In essence, Southwest Detroit has a significantly lower life expectancy than other areas, significantly higher asthma hospitalizations, and yet significantly lower voter turnout than the surrounding areas. Now, we're not blaming the city of Detroit, Southwest Detroit, or Chaldean Town for why they haven't been turning out to the polls. The fact of the matter is that they haven't been able to. But bridging this gap of access is imperative to ensure that their health outcomes improve throughout the years. How do we break this cycle? The cycle is when people vote, they are labeled as likely voters, and then campaigns continue to make contact with these areas. Why do you think Michigan is treated as a swing state? It's because when Michigan shows out, it really does determine how the country feels at large. And as a result, people tune into issues that are happening in the state of Michigan. They want to appeal to voters here because our vote really does make the difference for national elections. If we break this cycle, we can label people as likely voters, and this positive feedback loop begins to take shape. And we already have very promising indicators of success. One of our partners, nonprofit Vote, did this study where they promoted Get Out the Vote efforts across 1,000 different nonprofits back in 2018. And they found that when nonprofits reached out to their clients and patients who were encouraged to vote by the nonprofit, the folks who benefited the most were the ones who needed to benefit the most. So low-income patients and clients had dramatic impacts and had the largest turnout advantage. And look at what happens when you observe racial demographics. When a nonprofit reached out to patients from communities of color, they had dramatic improvements of voter turnout and the largest turnout advantage. This happens with age as well. When nonprofits reach out to clients based on their age groups, young patients and clients tend to do dramatically better and have a much higher turnout. So all of this is to say, there is an incredible opportunity for us here to change dramatically our relationship with health and voting in this country, and it's within our hands and our capability. There's also quite a few direct benefits of voting on health. This study in public health from a few years ago demonstrated that even when controlled factors like income inequality and state median household income, people are more likely to self-report fair or poor health in states when there's a below average voter turnout. And here, a child development study shows that voting among adolescents was associated with less risky health-related behaviors and fewer depressive symptoms in young adulthood. One potential reason for this could be that voting presents an opportunity to exert voice, perhaps establishing a path to health through empowerment. And I can give a personal example of this. When I was a teenager, I got really involved with civic engagement as a means to address the ongoing health crises I was seeing around me in Flint, Michigan. It was really devastating to see what was happening, especially given that it wasn't just something that was happening on the news that was so frightening. My friends were going through this, you know, the schools that we used to compete with in our sports like basketball and soccer were no longer able to show up because they just didn't have the capacity to anymore. And when I was able to tap into community-led efforts of civic engagement, I felt like I could do more with myself, and it kept me from maybe engaging in something that wouldn't have been as good for me. Another study in political psychology demonstrates that even after you control all factors, including race, age, political orientation or your political beliefs, education, folks who are more politically engaged, folks who registered, folks who voted, and folks who have higher political activism scores also reported higher levels of personal well-being. This is all just to say that passion can drive you in multiple ways. So why not let voting be one of them? Yet another study, a Journal of Preventative Medicine and Public Health, a study of 44 countries found that voter participation was associated with better self-reported health, even after controlling for individual and country characteristics. So people who vote feel a higher level of social connection and feel healthier. Because if you think about it, the more you know when you're voting, the more you know about the society around you. So it makes sense. So how is it that voting has such a high impact on health? A theorized benefit here is that there is a benefit of social connection. Voting promotes the social connection, and things that promote social connections will lower rates of anxiety, depression, and can increase your self-esteem and your sense of empathy for the world around you. And it can also give you better emotional regulation skills. It creates a positive feedback of social, emotional benefits just for all people around you, just by voting. Another reason why this work must continue is the racial and social inequities that persist. We need more solutions to this. Now, in 2020, there was some fantastic news from the AMA recognizing racism as a public health threat. This was an excellent step to build awareness of the historical legacies of racism that were systemic in this country. But there's still a risk here. The risk is that if we stop here, then all we've done is just become aware of an issue without taking action. We have to carry our effort beyond registration and take it to the polls. We cannot just sit with awareness any longer. We have to take our education and translate it into direct action this year at the polls and every year moving forward. So this brings up the question, what is optical allyship? Optical allyship is defined as allyship that only serves at the surface level to platform the ally. It makes a statement but doesn't go beneath the surface and is not aimed at breaking away from the systems of power that oppress. So in essence, bringing awareness to an issue without pushing it further. The National Academies of Science and Medicine, in their 2019 report, Integrating Social Care into the Delivery of Healthcare, urges hospitals, clinics, and healthcare providers to move from awareness to advocacy. The goal here is to implement concrete initiatives that are rooted in advocacy. We cannot just stop at what we see in front of us. We have to push forward. And allyship requires action. Helping patients vote is one concrete action that institutions can and should engage in to advocate for their patients and address upstream social and racial inequities. It's already happening here. Over 500 hospitals, clinics, and health centers are helping their patients vote as a partner of Vot-ER. And even more so, there are over 100 medical associations and organizations that work with Vot-ER, MICA being one of them, to help their members and their staff vote. But healthcare providers also need to vote themselves, because it's not just our patient population who isn't engaged in our electoral system. Studies have shown that out of eligible physicians, they voted 9 percentage points less than the general population between the years of 1996 to 2002. Now, I know that seems like a long time ago, and you might think, I mean, we've probably solved this by now, right? But it's actually gotten worse, unfortunately. I know you guys have busy schedules, and this is not me trying to shame anyone here at all. If anything, we all owe our lives to healthcare workers who truly are heroes in our society. Still, it should be pointed out that between 2006 and 2018, eligible physicians voted 14 percentage points less than the general population. Now, what does this mean? Obviously, we have so many people turning out in so many levels, but what does it mean when people on the floors of our hospital, people who see the real impact of policies on our patients and our institutions, what does it mean when they don't vote? We owe it to our patients to be at the table when it comes to deciding our nation's health policies. We are already making headway on empowering each other to make an impact and go vote. In fact, in the 2020 election, healthcare providers helped over 47,000 colleagues and patients get ready to vote. So don't underestimate the power of one person or one provider. A great example of this and the work that we do is seen through Civic Health Month. This is a nationwide celebration held each August to showcase the strengthening relationship between healthcare, communities, and civic participation. And just as a little note, in 2020, Vot-ER partnered with over 100 organizations in honor of Civic Health Month. In 2022, this expanded doubly to over 200 organizations. And some of these lovely groups include the National Association of Community Health Workers, the Society for Adolescent Health and Medicine, the National Association of Social Workers, and MICA. So who votes seems to substantially affect how governments raise and spend their money. When fewer people vote, and turnout is presumably more skewed by race, income, and other factors, the governments appear to behave differently than when turnout is higher and less skewed. This suggests that when disadvantaged groups fail to vote, local officials are more likely to be unresponsive to their concerns, which I know sounds scary, but is something that we have the power to reverse. The effects are substantial. Expanded turnout can increase the amount of money going to redistributive programs like health services, education, public housing, and welfare, up to being by a third. And this is all taken from America's Uneven Democracy, Race, Turnout, and Representation in City Politics. Now, as a health affairs article states, as many places as the US have declared racism as a public health crisis, the erosion of voting rights must be understood as a manifestation of structural and cultural racism, and thus prioritized for action. When democracy is weakened, social cohesion and public health suffers. The work that we do, incorporating voting into healthcare, works. As a study from the Center of Social Innovation at the University of California, Riverside found, for every 1% of total voters in a precinct that AltaMed contacted, the percentage change in voter turnout from 2014 to 2018 was increased by 8.3 percentage points. So if you help one person register to vote, they'll go home and spread the word about voting to their family and their friends. Don't underestimate your impact, not just as a provider, not just as a patient, but also as a person. So now let's talk about how Vot-ER helps specifically. The health space has a unique opportunity to help here. As you can see here, there are a number of people who think that healthcare workers and doctors are some of the most trustworthy people that they work with, largely due to the relationship built between patient and provider. Vot-ER creates easy-to-use, 100% nonpartisan tools and programs for civic engagements in clinical spaces. We have badges that can be worn on lanyards for teams and organizations. We have custom, free digital materials for teams and organizations. And we have email, text templates to help staff and patients vote. Our tools are undisruptive, completely optional, and entirely nonpartisan. Our mission is to provide structure to support healthcare organizations and healthcare professionals. For example, our community civic engagement program, our grant is for FQHCs to incorporate our technology and tools in order to expand voter reminders. So this goes beyond just voter registration, but also mobilizing folks to the polls with those reminders that they got to get out there. The Healthy Democracy Campaign is a wonderful opportunity for health professional students to tap in and get their competitive side going. And the Civic Health Partnership, Civic Health Month being in August, is a wonderful opportunity for our hospitals and associations to come together, celebrating the importance of the intersection of public health and democracy. So how does this work? Health professionals ask a simple question during social history, intake, or discharge. A doctor might ask, do you smoke? Do you drink? Do you wear your seatbelt? Another question they might ask is, are you registered to vote? In reality, these conversations will take up a small amount of time in each visit, but they make a huge impact for our patients. Vot-ER plays an important role in addressing the social determinants of health by meeting potential voters where they are and supporting them in becoming more civically engaged. That's a quote directly from Bill Ryan, VP of Government Relations over at Einstein Health. The healthcare space has been eager to get involved in civic health work. Vot-ER has partnered with over 350 hospitals, clinics, healthcare associations, and organizations. Our work has also been featured in the local news, and we're only heating up from this point. 79% of people said that Vot-ER helped increase their sense of personal agency to affect change, and 50% of our volunteers from the year 2022 said that Vot-ER helped protect them from workplace burnout. So I know that we're asking you to take on more work, but just remember how passion can really reignite something in you and protect you in the long run. So if you'd like to improve health equity through working with us, you can join us. So I'd like you guys to take a second, maybe screenshot this, or click on the link dropped in the chat if you're interested in partnering with us or interested in learning a little bit more about that. But if you have any questions about the legal FAQs surrounding this work, I'd like to reassure you all that there is a long-standing precedent and federal guidelines for voter registration in 501c3 spaces. And it comes from the NVRA of 1993. It encourages this type of work, especially if it's nonpartisan in health centers. 501c3 organizations can conduct nonpartisan voter engagement activities designed to help the public participate in elections. This includes voter registration, education, and get out the vote events, okay? And clinicians and healthcare organizations can point patients to our Vot-ER posters, badges, or handouts. We can tell patients that their institutions offer a service to help them register to vote, but we aren't here to tell you to endorse any political party or candidate. Again, everything that we do here is entirely nonpartisan, which is what makes it 501c3 compliant. You can also help patients fill out registration forms as long as you're remaining neutral. Now, in this next part of the conversation, I'd like us to kind of role play what this work might look like by doing some of our conversation starters. As an extension of this work, our work largely leans on the patient-provider relationship to really drive home voter registration. Remember that slide that showed how many people trust their doctor and their healthcare provider? Where this is exactly something we're going to model here. So in just a second, Nayana and I are going to role play. I will be the provider and she will be the patient, and we will demonstrate what a potential conversation could look like with someone who's looking to register to vote. Hi, Nayana. Are you ready?
Yes, I'm ready.
Hi there. Before I leave, I'd like to check if you're eligible to vote. Are you registered to vote at your current address?
I've actually never voted before, never really got into it.
Oh, can I ask why?
I just don't really know much about it. I don't feel like people talk about it where I live, so it's just not on the regular mind to thing to do.
I completely understand. Are you aware that voting this year, and every year moving forward can have significant positive outcomes for your health moving forward?
No, I didn't think. No, I didn't know that.
It extends beyond just voting for who's president. There's a lot of local positions where the work that these people do, whether they be your DA, attorney general, or mayor, their decisions have a really direct impact on your life. There's also a number of propositions on the ballot as well for you to consider that relate to education and funding and where your tax money goes. Does that sound of interest to you? I'd like to know where my money goes.
Yeah, I think it would be nice to know where my money is going for sure. Maybe to learn a little bit more of, the things that might be affecting my family.
Yeah, absolutely. Well, I don't want to rush you into anything before you're ready. So if you'd like to, you can take a picture of my badge right here, and it'll redirect you to a platform where you can walk through the process on your own time and register and just see when upcoming elections are and who's on your ballot. But I definitely encourage you to make a little bit of time to do this year.
Okay, thank you.
Thanks so much, Nyana.
No problem.
We'd love for y'all to practice these conversations yourself. So in just a second, our friend Lauren here will open up the breakout rooms where you can take turns practicing these conversations with a partner. So decide in the beginning who's going to be the patient and who's going to be the provider. And about 6 minutes in, we'll send a little bit of a nudge so that you can switch roles and practice the other way. So Lauren, when the breakout rooms are ready, I'll pan it to you.
Okay, I just opened those and just so we know, co-hosts, you might be assigned to a breakout room, just so we have an equal matchup here. So
Hey,
everybody,
Lauren, before you do that, are there some scripts that did you put that in the chat or
I can add it,
anything?
I can broadcast that, sure.
Okay, does anybody have any questions before we go into the breakout rooms? Okay, just wanted to give them a chance. Thanks.
I'm gonna send the chat, the conversation starters again in the chat, so you guys can click on that.
Thanks so much, y'all.
Looks like people are moving. And Mark, I saw your message, so I just added somebody else to that breakout room.
Appreciate it.
Aaron, would you
Ari,
mind
awesome job.
to room 2? Thanks.
Yeah, let's see. Breakout rooms are always seem like they should be so simple, but
Such is life, honestly.
right. 7. Okay. Okay, Victoria, it says you're in room 2. Should I?
I think I X'd out of it on accident.
Okay, I'll see if I can move you and then move you back.
Okay, sorry.
No, no worries, no worries. We'll try you.
Nyana and I got in the same room and we didn't know if that made sense.
See if that works. Possible that some people just haven't joined.
I left my breakout room.
Good.
Paula, you left your breakout room?
I did.
You want to go back?
I was the only one in there.
Oh, okay.
And I also don't have a voice right now, so I can't talk.
You sure don't. Oh, I hope you feel better.
Thanks. I think I'll just hang out here. I'm not seeing patients right now, but I do have some federally qualified health centers I could connect with in our region.
That's perfect. That would be terrific. And Myrna or Elizabeth, do you guys want to go to a breakout room? And if so, we can pop you into somebody. Mark, you're with Vot-ER, is that right?
Yeah, Mark is my supervisor at Vot-ER. Thanks so much for making the time to be here.
Of course. Sorry, I couldn't unmute myself. My computer's acting up. It's gonna die here in a moment too.
Okay, and then Christine, are you with Vot-ER? Myrna or Elizabeth, do you want to go into a breakout room? They maybe are
Oh.
just listening.
I'm not going to be able to stay, so it's not fair to get started with this, I don't think. So count me out on this.
Sure,
works.
sure, I understand.
Okay. Okay.
Myrna, Paula, and Mark were all in the same room, so that works.
Oh, I gotcha.
Oh, wonderful.
Ari, you're doing a great job.
Yeah.
You've really nailed this.
Thank you. I appreciate it. This is a great crowd.
So how many rooms do we have going?
Let's
10, it looks like.
Some of them are empty though.
Oh, do we want to pause the recording temporarily?
That probably would have been a great idea. Okay. And they're closing in 45 seconds.
Wonderful. It's like the countdown to the new year. Welcome back, folks. We'll just give it another 30 seconds or so to make sure everyone comes back. But feel free to start sharing whether you'd like to do it in the chat or unmute. How did it go and how do y'all feel?
Mary Lee, I'm sorry you ended up in a breakout room with someone's like recorder. I didn't know.
No, that's all right. I just started to read the newspaper.
Oh, here we are. We're getting people back now. That's great.
Welcome back, y'all. Thank you so much for participating in that. If you'd like, I'd love to hear if folks can share in the chat or unmute. How did it go? How do you feel? Was it different than you expected? Were the resources helpful?
I think we ended up just talking a little bit about our positions more than I don't think we had enough time to actually get into the role playing part.
Yeah, 10 minutes just flew by.
I know.
Before we knew it, it was over. So we're just getting going on that part. So
But I
Carol
will
did bring
say,
up a good point about like Cheryl, do you want to talk about what you kind of were wondering?
yeah, so even though we didn't play act, it was very useful to be able to have, sort of a, intimate conversation with a couple of people who, have done this before. And I got, one of my major questions answered, which was, what are the legal concerns? I mean, I know the law protects me, and I'm comfortable talking to patients, and I'd like to, get one of those things on my badge or my lanyard, but, should I get permission from, it's not my clinic, I work for somebody, I work for a hospital, an institution. And so we talked about that. And, so I think I got those kinds of questions answered. And I'm going to go do this, I'm going to sign up.
Great to hear that you're going to sign up. But to touch on that a bit, that's actually a really common concern, like getting administrative buy-in at like different levels. It's definitely something that we've struggled with. at some institutions. I will say though, everything we do here is legal. I would not be coming here and telling you to do something that is illegal or might get you in trouble in any kind of way. And our work here is HIPAA compliant. We're not asking you to collect sensitive information about patients. We're asking you to provide an additional resource to speak to them because your voices matter so much. And your connections with them are ones that like we could never replicate. Which is why we are so grateful to have these connections with healthcare providers and to really leverage them for a shared goal and vision in mind. But that concern of like, you know, it's not my clinic, you know, and I have to get like approval to do this. That's certainly something that we can continue to talk about offline if you'd like to connect with me, to kind of talk about what that might look like, how does organizing for greater administrative support look like? Because it's definitely been different at different organizations, you know, depending on whether you work for like a community health center that's smaller, or like a clinic that's larger, or like a hospital system, you know, that might have different rules and regulations. Some of them are okay with, you know, the badges, but are a little wary about maybe like the posters and things like that. So it kind of depends for every institution, which is why I can't give you like a straight, clear answer here, but I'd love to have that conversation if you'd also love to reach out.
Well, thank you. I appreciate that. I think my plan is to just ask my immediate, the immediate manager in the office, hey, you know, I would like to do this, and I'll just start basically with the, you know, lanyard, you know, thing and
Yeah.
the app. And I don't know if you have handouts, but, you know, maybe I'll take a look at those. I probably won't put up posters yet. I think I'll ease into it and then you know, go from there.
Makes sense. Yeah, you have to pace yourself. Lisa, you had something to add?
I had a question. Just curious, are there FQHCs or hospitals in Michigan that are doing this, you know, more widely?
Define more widely.
Well, are doing it at all, I guess. What extent are Michigan hospitals or FQHCs doing it that you know of?
Yeah, so we have so 2 of our CCEP grants have gone to community health centers in the Metro Detroit area. If you guys are familiar with Team Wellness Center or My Care. Another one also went out to one in mid-Michigan. And our clinician there is Christine Riley. We also have fellows who do this work at Henry Ford Hospital in the Metro Detroit area, at Michigan State University, and the hospitals affiliated with that in the Lansing area, such as Sparrow and McLaurin. We recently, it was a long and hard fought battle, but we had amazing volunteers win over the University of Michigan hospitals over in Ann Arbor. We have connections out in Flint and are hoping to make headway into Hurley and McLaurin Flint out there. So this organization is young. This is only really like our like 3rd or 4th official year of rolling out some of these programs. I know for our grant, it's like our 2nd year doing that. So we definitely have a lot of work to go, but I'd say we've certainly made some headway. And I will say, when certain organizations buy in, many more are keen to do so as well. So one victory ends up creating a domino effect, which is beautiful, if that answers your question.
I think that's awesome. I mean, really amazing work, Ari. That's great. And as somebody, Nicole put in the chat, really good news that U of M, you know, is starting to get on board. I do think, you know, U of M, MSU, that kind of stuff does, you know, help kind of get probably other groups. If they buy in, other groups might be more likely to buy in. So really, really excellent work. That's exciting. There was something else. Oh, Mary Lee asked a question. Are public health departments in Michigan doing any of this work? That's a great question, Mary Lee.
You mean like Ingham County Health Department, like the county health departments, things like that?
Yeah.
I don't think we're formally partnered with any of them yet, but that's definitely something that I've been trying to hammer into. I do have a couple of connections in Ingham County specifically and in Wayne County that I'm hoping will take us into like a formal partnership. But it's great that you flagged that because that's definitely something that we're hoping to accomplish, if not this year, very, very soon.
It would be really neat if MDHHS were to like encourage it in some ways, you know, the Michigan Department of, we have some contacts with them. I have no idea whether they buy into it or not. It would be nice if there was like a state, you know, sanctioning of it.
Yeah, that's a really interesting idea. And we can definitely connect on that as well. But I really, really appreciate this feedback, and how passionate you guys all are. Makes me feel like I'm doing a good job as a presenter. So thanks so much, for
You
your
did an
engagement.
excellent job, Ari.
Thank you. I'll wrap this up really quickly by just touching on a couple of things that frequently come up during these patient-provider discussions. Just wanted to check in. Can everyone see my screen? Yes? All right. So sometimes patients share that they or a loved one are undocumented or not a citizen. Generally, in the United States, only citizens are eligible to vote. But you can still talk to friends and family about the importance of voting and making sure that voices are heard. This is what's called relational organizing. When words of action, when calls to action are communicated from a loved one that you have an established relationship with, it's a lot more trusted and a lot more likely to be followed up on had it been something that they maybe randomly saw on like the internet or like randomly heard about through like a friend of a friend, you know? We leverage our relationships in all of this work, not just because it's powerful and impactful, but because we trust one another and we want what's best for one another. So we highly encourage sharing even photos of the badges, which is why we put QR codes on them to make them a bit more accessible. Another thing that comes up often is apathy. So there are a lot of Americans that feel really skeptical that their vote won't really make a difference. There's a lot of folks worried like, well, even if I cast my ballot, that's not to say that so-and-so might not get elected or so-and-so might not happen. But again, remember that healthcare providers pushed 47,000 people to vote in years past, just healthcare providers alone, you know, and most of the voter mobilization efforts are really not in the health spaces. So while we were new as an institution and able to accomplish this, imagine what we can do now that we're expanding our outreach to the major hospital systems and to several FQHCs and CHCs throughout the state of Michigan. I would highly encourage you to discuss with people the impact of you as an individual and how that ripples out, and just share this information far and wide. Sometimes one conversation isn't enough to change someone's mind, but as long as it plants a seed that we can nurture over time, that's what's important. So we keep talking about taking the next step and these badges, and we'd like to invite you all to order your badge if you'd like. You can order one for free with this link or this QR code right here, to just get started on your work here. And if you have any questions, I can drop my email address in the chat, so that folks can follow up with me if they need anything or if they'd like to dive in a bit deeper. That sums up my presentation for today. I'll pass it back to Nyana just to touch base on the CME CE credit one last time.
Thank you, Ari. So yes, thank you everyone for staying with us. Hope that you have learned something today, can take it back to your family and friends and to your where your place of work is. So this is how you can claim your CME CE credits. If you text the activity code here, which is 33042 to this phone number, you do need to record your attendance within 12 hours of the event. So just making that known, because I think if you miss it, it might become a little more difficult to be able to claim it. So I'd say if you can, try to do it now. Make sure that you do have, you're signed into your WMed portal. This kind of gives you some information here. I think there is an additional link, Lauren, if you have that, give us a little bit more in depth. Like, I think it's like a little like video that shows how to claim. But if anyone has questions, definitely feel free to email myself or Lauren to figure out how to be able to claim CME if you have any troubles. But again, just thank you and make sure you collect your credits.
And
Thank
I
you
think
so much.
Mary Lee, I
Oh,
want to get to your question, but I just wanted to say I put a link in the chat because we're going to meet next week, Friday, to kind of have a action session and think about how we can engage with Vot-ERs work in our Get Out the Vote campaign. So consider joining us next week, Friday with that registration link. And yeah, Mary Lee, do you want to go ahead?
Oh, it's a quick question. It would be helpful for everybody to get the link to how to get involved in the Civic Help Fellowship. It's they can't do it for this year, but they can do it for next year because a new cohort already started. But that's another way of getting healthcare providers educated, and you do a project, and that's pretty cool.
yes, thank you so much, Mary Lee. Mary Lee was one of our rock star fellows previously on this amazing team of nurses. And so of course she's going to advocate for something that has been so profound. And we honestly gained so much from you being there. So thank you so much.
Thanks.
Yeah, of course. I can definitely drop that link in the chat to our programs at large if folks are interested, including the fellowship. As she said, we aren't recruiting for this year as the cycle has already begun. But if this is something that you're interested in for 2025 or beyond, just keep it in your back pocket. It's a cool opportunity.
Awesome. All right. Well, I think that's all for today. Thank you so much, Ari. That was an incredible presentation. We really appreciate it.
Lauren, did you need to do the post poll or did
poll. Okay, we might have lost our might be skewed data. I think we lost some people. But if anybody wants to say how this webinar changed their mind about any of these factors, go ahead and stick around and do that. But I won't hold you to it.
And I want to thank Ari very, very much for an awesome presentation. We so appreciate the work of Vot-ER. I want to emphasize what I want to thank each of you for being here, and I want to emphasize what Lauren had mentioned about the fact that next Friday we're doing an action-R, which is kind of an informal get-together. But if you can, and if you want to ask other people as well, we want to really brainstorm how we can help get people to the polls. And what, we want to think about writing letters to the editor and op-ed, what kind of questions to ask candidates, what can we do to activate people and stay within the 501c3 point of view, and recognizing we're centering this in everything we do with health, climate, and equity. They're all related, and we could use your help and your creativity and your energy next Friday if you have that time. So great job, everybody, and thank you for being here.
Thanks so much, y'all. Have a good night.
Thank you.
Thank you.
Thanks so much, Ari. That was awesome. That was incredible.
You did a really, really nice job, Ari. Thank you.
Yeah, you're
Thank you so much. I really appreciate y'all's support. I think we can probably end the recording too.
Oh my gosh.
Did we start it back up?